Welcome to a reading of Module 9, NSTP 1. So our topic will be the first aid. Lakas. Okay, welcome to Module 9 of NSTP 1. In this module, we will be discussing the legal consideration and ethical concerns for first aiders, the principles of cardiopulmonary resuscitation or the CPR, and proper procedure for children and infant CPR. At the end of this module, we will be able to, number 1, describe the proper attitude of a first aider. Number 2, explain the method involved in surveying the scene, check the responsiveness, and activate medical assistant. Number 3 is comprehend the information of breathing principles and how oxygen is distributed to the cell of the blood. Number 4 is acknowledge on how to check the airway, breathing, and circulation. So it's ABC. And the number 5, demonstrate the basic knowledge in CPR for child and infant. So what's the first aid? First aid in NSTP Book 1, 2015, the immediate care administered to an injured person usually performed by an individual who do have limited skills in medicine. It is usually performed to deal with satisfactorily the injured or illness of the victim, such that in the case of small cuts, minor bruises, blister, blisters, and even cardiac arrests until the next stage of care as an ambulance or doctors arrives. First Aid and CPR, 1999. So, it's a book from First Aid and CPR 1999, first aid does not take a place of proper medical treatment. It consists only of furnishing temporary assistance until competent medical care, if needed, is obtained, or until the chance for recovery without medical care is assured. Most injuries and illnesses do not require medical care. Properly applied first aid may mean the difference between life and death, rapid discovery and long hospitalization, or temporary disability and permanent injury. First aid, First aid involves more than doing things for others. It is also include the things that people can do for themselves. The ability to recognize a serious medical emergency and knowledge of how to get help may mean the difference between life and death. The problem is that the recognition can be delayed because neither the victim nor bystanders know the basic symptoms. Like, for example, a heart attack victim may wait hours after the onset symptoms before seeking help. Moreover, most people do not know first aid. Even if they do, they panic in an emergency. Consent. Okay. So the first module, even if they know, they panic in an emergency. So not all the people are knows how to do the first aid. And most of the time, nagpapanik tayo pagka nagkakaroon na ng mga emergency. So, hindi na natin maisip pa kung ano pa yung first aid na pwede nating ibigay sa tao o kahit sa atin mismo. So, there's a legal consideration and ethical concerns for first aiders. Number 1 is consent. Before giving first aid, a first aider must gain consent from a victim. Touching another person without his or her permission or consent is unlawful and could be grounds for a lawsuit. Likewise, giving first aid without the victim's consent is unlawful. Express consent. Consent must be obtained from every conscious, mentally competent, like for example, able to make a rational decision, adult, like for example, a person of legal age. Tell the victim your name and that you have first aid training and explain what you will be doing. Permission from the victim may be expressed either verbally or with a nod of the head. Implied consent. Implied consent involves an unconscious victim in life-threatening condition. It is assumed or implied that an unresponsive victim would consent to life-saving interventions. Consent also implied when first aider begins care and the victim does not resist. When life-threatening situation threaten a child and a parent or legal guardian is not available for consent, first aid should be given based on implied consent. Do not withhold first aid from a minor just to obtain parental or guardian permission. Abandonment. Abandonment means terminating the care of a victim without ensuring continued care at the same level or higher. Once you have responded to an emergency, you must not leave a victim who needs continuing first aid until another competent and trained person takes responsibility for the victim. Negligence or negligence. Negligence means deviating from accepted standard of care that result in further injury to the victims. Factors involved in negligence include number 1, duty of act, number 2, breach of duty, number 3, injury and damages inflicted. Other than physical damage, injury and damage can include physical pain and suffering, mental anguish. So it can the injury and damage can include physical pain and suffering, mental anguish, medical expenses, and sometimes loss of earnings and earning capacity. Duty to act means following guidelines to standard of care. Standards of care ensure quality care and protection for injured or suddenly ill victim. Breach of duty. Generally, first aider breaches, like for example, breaks his or her duty to a victim by failing to provide the type of care that would provide by a person having the same or similar training. There are two ways to breach one duty. Number one is acts of omission and acts of commission. An act of commission is the failure to do what is reasonably prudent person with the same or similar training would do in the same or similar circumstances. An act of commission is doing something that a reasonably prudent person would not do under the same or similar circumstances. Forgetting to put on a dressing is an act of omission. Cutting a snake bite is an act of commission. So again, breach of duty. Generally, first aider breaches his or her duty to a victim by failing to provide the type of care that would provide the person having the same or similar training. There are two ways to breach one duty. Number one, acts of omission and acts of commission. An act of omission is the failure to do what is reasonably prudent person with the same or similar training would do in the same or similar circumstances. An act of commission is doing something that reasonably prudent person would not do under the same or similar circumstances. Forgetting to put a dressing is an act of commission. Cutting a snake bite is an act of commission. Good Samaritan laws. Laws, known as Good Samaritan laws, encourage people to assist others in distress by granting them immunity against lawsuit. While the laws vary from state to state, Good Samaritan immunity generally applies only when the rescuer is. Number one, acting during emergency. Number two is acting in good faith, which means he or she has a good intentions. Number three is acting without compensation. And number four is not guilty of any malicious misconducts or gross negligence towards a victim. Cardiopulmonary resuscitation or the CPR. This is from the NSTP Book 1, 2015. This is the method used in saving life by rescuing who collapse from cardiac arrest. If performed correctly and on time, CPR may restore the victim's heart function and will definitely increase his or her chances of survival. Thus, full knowledge in the correct application of CPR to the victim in any eventualities that may occur can be used to help victims of a cardiac arrest. Sequence in applying CPR. How and when to apply the CPR is a question that always bothers every person who do not have knowledge in CPR. How to apply CPR in the sequence that will be explained in this context step by step. So there's a step one. Step one is survey the scene. Before anything else, as first aider, you must always consider if the scene is safe. You have to check everything and anything that is not safe, like the escaping steam, downed electrical posts and lines, traffic conditions, about to fall debris, about to fall debris, and extreme weather condition like flood also is the scene like flood. Okay. About to fall debris and extreme weather condition like flood. Also, is the scene area free from poisonous gas? About to collapse structures? Is there's a natural gas? Is there's a natural gas, or there's a propane or other substances that could explode? If any of these above mentioned concerns are present in the scene, you must move the victim as quickly and as carefully as possible. Try to remember that the dead or injured heroes are no help to anyone. Carefully examine number of victims involved. If somebody is screaming for help, you might not notice an unconscious victim lying just beside you. Also, it is easy to overlook a small child or an infant. In cases where in two or more persons are involved, you have to prioritize care, meaning you have to decide whom to help first. Step 2. Check for responsiveness. If someone is unconscious, tap him or her on the shoulder just enough to awake an unconscious victim, but not too hard that might inflict additional injury to the victim. Be sure that you are heard by the victim shouting him or her at his attention. If the victim is infant, check the responsiveness of the infant by flicking the bottom of the infant foot. This will enable the first aider to determine if the infant is responding or not. Step 3 is to activate medical assistance. Bystander can be of much help. You can ask them to assist and help you. Bystander can tell you what happened or make a call for help while you are doing first aid to the victim. Likewise, bystander who are family member for a neighbor who is at the scene, he or she can provide information of the victim medical conditions and of the victim's relative and other who are frightened of the incident. Step 4. Do the primary survey check, the ABC, airway, breathing, and circulation. Before applying rescue breathing or the ventilation to the victim, it is of vital importance to open and check the airways of the victim, the entrance point of the oxygen and exit point. The airways serve as the exit point of carbon dioxide. Blocking the airway may result respiratory or cardiac arrest if not treated immediately. The technique used to open the airway is the so-called head tilt chin lift technique. The victim position lying on her or his back with one hand on the forehead and the other hand under the chin. The victim's head is tilted back and the chin is lifted, thus making sure that the victim's jawline is 90 degrees to the ground. Step 5. Continue the primary survey. Open the mouth by pulling the chin gently. Basically, it is quite hard to open the mouth of an unconscious victim. Hence, you have to apply an extra amount of strength to pull down the chin in order to open the mouth. in order to open the mouth of the victim. So, step 5, continue the primary survey. Open the mouth of the Open the mouth by pulling the chin gently. Basically, it is quite hard to open the mouth of an unconscious victim. Hence, you have to apply an extra amount of strength to pull down the chin in order to open the mouth of the victim. Once it is open, carefully examine for any foreign objects inside the mouth of the victim. If any, use your finger or the index finger in hook formation to remove the object. Do not forget to wear surgical gloves before starting CPR. Number 6 is continue the primary survey check for breathing and circulation. Breathing principles. Human respiration works by inspiring fresh air, absorbing part but not all of the oxygen in it, which is then distributed to cells of the blood. And exchanging carbon dioxide, lungs has a capacity of 12 liters. When a victim stops breathing, spontaneous respiration can restart. If stimulated by suffocation, however, a victim in respiratory arrest is likely to fall into cardiorespiratory arrest. Checking the breathing. Using LLF or look, listen, and feel, place your cheek and ear approximately 2 to 3 centimeters away from the victim's mouth and nose, looking at the same time at the chest of the victim. Doing such method in checking for the breathing, you will detect the following signs if the victim is breathing. Number 1 is through the cheek. You can feel the airflow coming from the victim's mouth and nose. Number 2 is through your ear. You can hear the airflow. And number 3, can see the rise and fall of the chest. Checking the circulation. To check the victim's pulse in the neck, put your middle and index fingers approximately 2 to 3 centimeters away from the Adam's apple and press lightly the serratoid artery. The serratoid artery for up to 10 seconds. So, nahirapan ako rito kasi kulang-kulang siya ng mga dapat gamiting mga... Checking the circulation. To check the victim's pulse in the neck, put your middle and index fingers approximately 2 to 3 centimeters away from the Adam's apple and press lightly to serratoid artery for up to 10 seconds. If the pulse is not felt or the victim does not show any signs of movement or breathing, start the CPR. Step 7. Reactivate medical assistant. Following up requests for medical assistance and ambulance or to transfer facility, remind the bystander to follow up the call for medical assistance. The more bystander who will follow up for medical assistance, the better, and the more medical assistance and transfer facilities to come for help, the better, rather than none at all, because nobody cares to follow up for help. Step 8A, application of CPR. Compression principles. Basically, the objectives of doing chest compression are to effectively squeeze the heart inside the victim's chest, causing the blood to flow. It allows the normal gaseous exchange between the lungs, bloodstream, and tissues to occur. The theory why compression is commonly the preferred method in first aid is due to for a fact that when a normal breathing and circulation stop, there is still a good amount of residual oxygen left in the bloodstream, as it has no way to exchange out of the body. Technique in compression. First, position your body correctly by kneeling correctly beside the victim's upper chest, aligning the center of your body to the nipple of the victim or in the middle part of the sternum or the breastbone. The position of the body is vital when giving chest compressions. Compressing the victim's chest straight down will help you reach the necessary 2 inches depth for adult and child, and 1.5-inch depth for infant. Thus, using the correct body position will be less tiring for you. The objective is to compress in the center chest regardless of the victim, meaning the compression are performed on the sternum or in the breastbone of the victim aligned to the nipple of the male or the female or in the children. Second, to locate the sternum notch. Use your index finger, trace the lower edge of the rib cage, and together place your index finger with the middle finger and place the heel of your other hand at the side of the index finger. Release the 2 fingers and place such hand on top of the other interlocking the fingers from both hands to secure the position. Keep your arms and elbows as straight as possible, enabling your shoulders directly over your hand. Step 8B, application of CPR. Chest compression and on rescuing breathing, give 30 chest compression, push hard, push fast at a rate of at least 100 compressions per minute. The compressions per minute refer to the speed of compressions, not the number of compressions given in a minute. As you give compression, count loud. Give compressions by pushing the sternum down by at least 2 inches. 2 inches. The downward and upward movement should be smooth, not jerky. Push straight down with the weight of your body to create the force needed to compress the chest. Hence, if your arms and shoulders tire quickly, you are not using the correct body positions. After giving the 30 compressions, pinch the nose and give 2 rescue breathing or the ventilation to the victim. Each rescue's breathing should last to about 1 second to make the chest rise. Making compression effective. Allow the rib to come back after each compression. This technique allows the heart chamber to refill. Too close spacing compressions will lead to ineffective compressions. Your objective is to comply the rate of 100 compressions per minute. This includes the time to ventilate the victim. In the actual practice, you must get over 2 cycles of 30 compressions with a rescue breathing per minute. However, it is advised to every first aider to make the 5 cycles into 2 minutes. Almost all compresses the chest too fast. Observation based on experience reveals that almost all, even the well-trained first aiders, almost all compresses the chest too fast. Observation based on Observation based on experience reveals that almost all, even the well-trained first aiders, compresses the heart too fast. The compression rate that you should aim is only a little over 1 per second. Always observe to keep your arms straight. Bending of elbow while doing the compression is not correct. You should always keep your elbows locked and arms straight on top or perpendicular to your hands. Make a habit of counting loud. Doing a 30 compressions and 2 rescue breathing to the victim for 5 cycles is very tiring. Hence, in order not to lose your count, you must exert effort in counting out loud. The technique will further enhance your morale and boost your energy in finishing your task without losing your counts. Compressions are likely to break ribs. Doing compressions on older people are more likely than not to break ribs or the sternum itself. If this happens, just continue the compressions. The cracking sounds that you hear is just a cartilage of the ribs and not the bones themselves. Hearing such a sound is a sign that you are performing good and strong compressions. Step 9. Recheck the breathing and circulation. So step 9, recheck the breathing and circulation. When to stop the CPR, first order is mandated to continue giving CPR to the victim until when there is an obvious sign of life like breathing spontaneously. When the victim vomits, once the victim vomits, it clearly shows an active mechanism wherein the victim moves and actively vomits. If the victims roll them to the other side, clear the airway. Once they done vomiting and reassessness, airway, breathing, and okay, got it. Once they done vomiting and reassesses airway, breathing, and circulation. When qualified help arrives, this could be an ambulance service or a doctor or a responder with a defibrillator. However, do not stop until told to do so. Most likely, they need time to set up their equipment. Hence, just continue applying CPR until instructed to stop. When you are exhausted to continue CPR, When you are exhausted to continue, CPR is physically very demanding and continuous application of it to the victim can be exhausting. When the scene becomes unsafe, expect the unexpected hazard can change. So when the scene becomes unsafe, expect the unexpected hazards can change. Step 10, recovery position. Number 1, from your present position, kneeling at the side of the victim, reach the arm of the victim farthest from you and lift the said arm, aligning to the body beside the head of the victim with the patient palm facing upward. Number 2 is put the victim arm closest to you and place such arms to the side of the victim. So, hindi ko na-gets. Ulitin ko Step 10, recovery position. From your present position, kneeling at the side of the victim, reach the arm of the victim farthest from you and lift the same arm, aligning to the body beside the head of the victim with the patient's palm facing upward. Number 2 is put the victim arm closest to you and place such arm to the side of the victim. Grasp, number 3 is number 3, grasp the pants of the victim at the top, at the knee, and bend it almost 90 degrees. Number 4, cup the base of the skull by the palm of your hand nearest to you. Caution, do not leave or push the head of the neck of the victim. Number 5, put your other hand under the arm and hip nearest to you if the victim is wearing long pants. Number 6, roll the victim away from you in a smooth motion by lifting your hand and forearm, making sure at the same time that the victim's head remains in contact with the extended arm, and be sure to support the head and neck with your hand. To perform CPR on a child. Cardiopulmonary resuscitation, CPR 2017. The procedure for giving CPR to a child age 1 through 8 is essentially the same as that for an adult. The American Heart Association also sorry. The American Heart Association also recommends the following to perform CPR on a child. Number 1, if you're alone, perform 5 cycles of compressions and breathe on the child. This should take about 2 minutes before calling your local emergency number or using. Number 2 is use 2 hands or only 1 hand if the child is very small. To perform chest compression, press straight down on or to compress the chest about 2 inches, approximately 5 centimeters. Number 3 is breathe more gently. Number 4, use the same compression or the breathe rate as is used for adults. 30 compression followed by 2 breaths. This is 1 cycle. Following the 2 breaths, immediately begin the next cycle of compression and breathe. If there are 2 people conducting CPR, conduct 15 compressions followed by 2 breaths. Number 5, after 5 cycles, about 2 minutes of CPR. If there is no response and an automated external defibrillator, AED, is available, apply it and follow the prompts. Using pediatric pads if available for children's ages 1 through 8. If pediatric pads aren't available, use adult pads. Do not use an AED for children younger than age 1. Administer 1 shock and then resume CPR, starting with chest compressions for 2 more minutes before administering a second shock. If you're not trained to use AED, an emergency medical operator may be able to guide you in its use. Continue until the child moves or help arrives. To perform CPR on a baby. Most cardiac arrests in babies occur from lack of oxygen, such as from drowning or choking. If you know the baby has an airway obstruction, perform first aid for choking. If you don't know why the baby isn't breathing, perform CPR. To begin, examine the situation, stroke the baby, and watch for response, such as movement, but don't shake the baby. If there's no response, follow the CAB procedures below and time the call for help as follows. Number one is if you're the only rescuer and CPR is needed, do CPR for 2 minutes, about 5 cycles, before your local emergency number. If another person is available, have that person call for help immediately while you attend to the baby. Compression, restore blood circulation. Place the baby on his or her back. Place the baby on his or her back on firm, flat surface, such as table, the floor, or ground also will do. Imagine a horizontal line drawn between the baby's nipples. Place 2 fingers of one hand just below this line in the center of the chest. Number 3, gently compress the chest about 1.5 inches. It is about 4 centimeters. Number 4, count aloud as you pump in a fairly rapid rhythm. You should pump at a rate of 100 to 120 compression a minute. Airway, clear the airway. After 30 compressions, gently tip the head back by lifting the chin with one hand and pushing down on the forehead with the another hand. If no more than 1 second, put your ear near the baby's mouth and check for breathing. Look for chest motion, listen for breath sound, and feel for breath on your cheek and ear. Breathing, breathe for the baby. Number 1, cover the baby's mouth and nose with your mouth. Prepare to give 2 rescue breaths. Use the strength of your cheeks to deliver gently puff of air. Instead of deep breaths from your lungs, to slowly breathe into the baby's mouth 1 time, taking 1 second for the breath. Watch to see if the baby's chest arises. If it does, give a second rescue breath. If the chest does not rise, repeat the healthy chin lift, head tilt chin lift maneuver, and then give the second breath. Number 3, if the baby chest still doesn't rise, examine the mouth to make sure no foreign material is inside. If an object is seen, sweep it out with your finger. If the airway seems blocked, perform first aid for a choking baby. Number 4, give 2 breaths after every 30 chest compressions. If 2 people are conducting CPR, give 2 breaths after every 15 chest compressions. Number 5, perform CPR for about 2 minutes before calling for help unless someone else can make the call while you attend to the baby. Number 6, continue CPR until you see signs of life or until medical personnel arrive. So we have here the glossary. Ceratoid. This is the horn-like, especially in shape. We have here internal cardiac defibrillator. This is the device put within the body that is designed to recognize certain types of abnormal heart rhythms or the arrhythmias, yes, and correct them. Number 3, sternum. Commonly known as the breastbone, is a long, narrow, flat bone that serves as the keystone of the rib cage and stabilizes the thoracic skeleton or thoracic skeleton. I think it's thoracic. Several muscles that move the arms, head, and neck have their origins on the sternum. Thoracic or thoracic, pertaining to the chest. We also have the references and supplementary materials. NSTP Book 1, page 141 to 150 by Kilang Alexandre et al. Jim Sybil Publications, Malabon City. The copyright, it's copyrighted 2012. ISBN 9789719676065. Also, we have this First Aid and CPR by the National Safety Council. Publishers are Jones and Bartlett, Sudbury, Massachusetts, 1999. ISBN 076370896. We also have here the cardiopulmonary resuscitation or the CPR. First Aid Mayo Clinic Staff 2017. This is from www.mayoclinic.org. First Aid CPR Basic and Art. So Ceratoid, www.thefreedictionary.com. Internal cardiac defibrillator. So the glossary is the meaning of our glossary words are from internet also. So that's all for the first aid module, and I'll see you again later for the bandages, the last topic of the first of an NSTP. Maraming salamat po and good night.